Hi, this is Dr. Sai Praveen Haranath from Apollo Hospitals, Hyderabad. I'm a pulmonologist and a critical care specialist. I'm going to tell you briefly about something called the Respiratory Distress Syndrome or adult/acute respiratory distress syndrome. One of the ways that the human lung performs is to exchange oxygen in and carbon dioxide out. And if you actually stretch the human lung out, it's the size of a tennis court. In respiratory distress syndrome, something triggers to make the lungs get inflamed and the normal surface area decreases and the lung actually starts getting filled with fluid. It's not unlike having a situation where someone's drowning and the lung is not able to do its normal work. If you get a hurt on the hand, you get a little swelling. Or if you get a cut, you get a scar. The same things happen inside the human lungs. If you were to get an infection in the lung, or you were involved in a road traffic accident, or you had a condition called pancreas inflammation, or sometimes even unknown causes, or even from a situation as a effect of an infection, not just in the lung but somewhere else, what we call sepsis. In all these situations, the lung can flare up. And if it flares up, the lung can get filled with fluid, start getting scarred, and it gets harder for the lung to do its job of opening up and closing and getting the air in and out. And people end up with ARDS. Now, ARDS, or the Adult Respiratory Distress Syndrome, is a condition that has affected millions of people around the world for a long time. Fortunately, the science has advanced quite a bit, and even what you saw in the COVID crisis with ARDS is something that we know how to manage. Not everybody does well, but most people actually do well with evidence-based care. One of the principles we use when we treat somebody with ARDS is to watch the pressures in the lung to see that we're not inflating too hard. We also measure the oxygen level, we check the carbon dioxide level, and despite all these technical things, the good news is that people who get through ARDS often go back to their normal lives. It may take some time, but it does work. To treat ARDS well, you need a critical care team who can diagnose this correctly. You need a good person who can handle the ventilator, who can understand how the ventilator and the patient are interacting. And the ventilator is essentially a machine that helps the patient breathe when they can't breathe on their own. In ARDS, we get chest x-rays to look at the lungs, and lately we've been doing something called prone ventilation. You might have heard that, but if you lay on your stomach and breathe in ARDS, sometimes the oxygen level gets better. So there's a lot of intricacies to managing the patient with ARDS, and we can actually do this even remotely now, where in our hospital, for example, we have a telemedicine system to look at patients with ARDS. So respiratory distress syndrome, not very common, but very common in intensive care unit. Thank you.